Hello friends, so now I am going to make a video on the topic polycythemia, you can see, and here and after the session you will be able to understand. So here different types of polycythemia, and here describe the effects of polycythemia on the circulatory system. So here basically that these two parts, will cover. So first of all, that I am going to discuss you about a definition of polycythemia. But before understanding a definition, that you should understand that is the normal RBC range, that is the normal concentration of RBC that you know that in adult males it is 5 to 5.5 million per millimeter cube, and in females it is 4.5 to 5 million per millimeter cube. And the region is that, so here basically there are two main regions. The first of all is that, so here basically that is the hormone level, hormones, and the second one is the menstruation. So here, and these two factors that is cause, so here decrease in the erythrocyte or the RBC count in females. So first of all, that now you can see here that in the case of polycythemia, that you can see here that is the RBC count or the concentration of RBC range is between 5 to 7 million per millimeter cube. So you can observe that it has increased, and here and this makes a definition of polycythemia. So try to write the definition of polycythemia. Please make pause and write. Have you written? Okay, so now I'm going to tell you. So simple that it is the, so here increase in the RBC count above the physiological range, and this is known as polycythemia. So therefore that is the first part, that is a definition of polycythemia has been covered, that is an increase in RBC count above the normal physiological range of RBC. Now I am going to explain about the causes of polycythemia. So first of all, physiological cause. So physiological cause, before understand the physiological cause, that is I also that is taught you about hypoxia, that is in erythropoiesis. So please try to recall the definition, that you have to write this definition hypoxia. So please try to recall and then write and then come to a video. So have you written? Okay. So what is hypoxia? So hypoxia is basically, so friends, so now you can see here basically hypoxia is simple, that decrease in oxygen supply to tissues, or if someone has written basically decrease in oxygen availability to tissues, it is also okay. So that is, now you can see here that is hypoxia, that is it causes decrease in oxygen supply to tissues. And here and the function of RBC that you have been studying since the class 9 also, that to transport oxygen. So now you can see the regulation, that is how they are regulated. Yes, I know. So first of all, physiological cause. You know that that is at high altitude. So here basically partial pressure of oxygen decreases. So here like in Himalaya or at high altitude area, so therefore partial pressure oxygen decreases, and this also decreases blood supply to tissue, so therefore hypoxia occurs, and this hypoxia stimulates erythropoietin to increases erythropoiesis production, and this increases erythropoiesis production, and this leads to RBC. That means so here concentration of RBC increases above the physiological range. So this is the physiological cause of polycythemia. And now I am going to explain you about the pathological cause of polycythemia. So about the pathological cause of polycythemia, so that before this you should do the normal situation. So therefore that is the from homocytoblastic cells, so therefore basically RBCs are produced. But this, so here, but there is a negative feedback mechanism. That means if the so here RBC concentration is more, so then automatic that this production decreases. that this production decreases, and vice versa. That means if this is less, then this production increases. So therefore, so here on the basis of this negative feedback, that this, so here basically RBC concentration is maintained within the normal physiological range. But here in case of polycythemia, you can see here that this homocytoblastic cells undergo, so here for so here mutations or genetic aberrations. As a result, so here that is the production of RBC goes on increasing, and also there is no negative feedback. So therefore RBC production goes on increasing. So this is the pathological cause of polycythemia. Now I am going to explain you about the effect of polycythemia. So first of all, that you have seen that in polycythemia RBC concentration increases, but here there is RBC concentration increases, and along with this increase in RBC concentration, the total blood volume also increases, and this leads to increase in blood viscosity. And here and this, and as a result, so your blood flow reduce and blood capillaries become blurred. Now I am going to show you the so here diagram also. So friends, you can see here that this so here due to the plugging in the blood vessels, that is the flow of blood is reduced. So therefore, and here and this is also the viscosity. Blood viscosity reduces blood flow to small vessels and raises the risk of blood clots. So therefore that is the blood clots done, and then so your blood flow reduced, and as a result also blood capillaries become blurred also. Now also the second point also like there, and here there is, as I have mentioned, that is a blood viscosity increases, and this also increases peripheral resistance also, and as a result that is arterial blood pressure increases. So here like this, and here, and this leads to hypertension. So here have you seen, so here this is the high blood pressure. So here this is also the effect of, so here basically polycythemia. Now so here basically, and the other one is that, so here that you all know that that is the this is the arterial plexus, this is the venous plexus, and these are the skin capillaries, and through this, so here that is and here that is skin capillaries. So here gaseous exchange occurs, and this supplies oxygen to skin tissues. Now so here that this is the normal. So the required amount of oxygen is supplied because RBC concentration is normal. But here you can see here in this case, so here that is more and more oxygen supply because of polycythemia. But now that is one question you have to ask, that is whether blood flow increases or decreases. So therefore now that is in these skin capillaries. So now please think and then come to a solution. Okay, have you thought now? So now just you think, so here that is blood RBCs, they are passing through these blood capillaries, and they have to supply this oxygen to tissues. If they have to supply more oxygen, then they have to stay more time in these blood capillaries. If they have to stay more time in these blood capillaries, and they have to enhance oxygen capacity, if they run at a faster rate, then this oxygen supply will be not good. So here if RBCs go through these skin capillaries at a faster rate and stay at a slower time, then this oxygen supply will be not good. But if they go slowly and stay for longer time, then this oxygen supply will be increased. No. Therefore, that is in this case also a speed of blood flow through skin capillaries decreases. That's here. So friends, so now so here also it is the region, that is, so here from here to here basically the physiological cause of polycythemia mentioned, basically why polycythemia happens, and here, and this is the pathological cause of, so here polycythemia versa, basically it is the pathological cause of, so here polycythemia, and here also, and this is the effect, so here basically of polycythemia, basically this increases the, so here blood viscosity. Huh. And here if you want to read also, simply you can read by simply pausing the video or like that. And this explains the effect of polycythemia on function of the circulatory system. So here also, and this is, so here mentioned about the increase in the blood pressure, the arterial pressure, and here and this part, so here basically is the explanation of, so here is related to this part also, that is I explained. Basically the speed of blood flow through the skin capillary is reduced, and this causes, so here basically a person with polycythemia vera ordinarily has a ruddy complexion with a bluish or cyanotic tint on the skin. So friends, if you want to study from here also. So here this is the physiological cause. So this is a physiological cause of polycythemia, and this is the pathological. So here and up to here it is a pathological, and this is the, so here effect of polycythemia, and this is also the effect of polycythemia, and this causes hypertension and this causes cyanosis. So that's all about polycythemia. Thank you.